Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is October 23rd, 2020. As always, we start with the COVID-19 statistics. Worldwide, we have over 42 million cases and nearly 1.15 million deaths. In the United States, we have over 8.7 million cases and nearly 230,000 deaths. We found out a lot about COVID-19 this week, some bad, a lot good. Let's go ahead and start with the bad news first. A few months ago, we mentioned in a report that some children were experiencing a serious complication that seemed to be related to COVID-19. It's called multisystem inflammatory syndrome in children, or MIS-C for short. There have now been over 1,000 cases and 20 deaths from MIS-C. Doctors are also starting to see this now in adults, and so they've named that MIS-A for adults. We also talked about the Sturgis motorcycle rally a few reports ago. There's no way to know exactly how many cases were caused by that rally, mostly due to the fact that South Dakota and many of the surrounding states were, and in many instances still are, terrible at doing the contact tracing. Despite that drawback, we can piece together an idea of its reach from the limited data we have, the anecdotal evidence, and the current conditions there. North and South Dakota, Wyoming, Minnesota, and Montana, all states with high representation at the rally, are now some of the highest in new cases per capita. Some of that for sure is due to the reopening of schools and cooler weather drawing people inside, but other states with more students going back to school and also experiencing cooler weather haven't had nearly as large an increase in cases. As we pointed out in many previous reports, the more time you spend without a mask in an enclosed space, especially if you're close to others, the more likely you are to catch the virus that causes COVID-19. And that's exactly what happened in Sturgis. It's no surprise that South Dakota and the surrounding states have had a huge increase in cases. Though the Midwest is experiencing some of the worst case rates, only 2 U.S. states are actually decreasing in cases. Some states are holding steady, but over half of the states in the U.S. are seeing an increase in cases. Some more bad news is that a new study has shown that about 20% of people who get COVID-19 never get the antibodies for it. It's unclear if that same percentage will hold true for immunity granted by vaccines, or if the stronger immune response that the vaccine trials have seen so far in patients also means that everyone will develop some level of immunity. We'll have to do more trials on that. The same study also reinforced the information we already had, that those in bigger groups tend to catch COVID-19 more easily. This holds true for big families or big apartment complexes. Even just 1 or 2 infected people can infect a lot of other people if they are not properly isolated. Another study has shown that infusing COVID-19 patients with blood plasma from those who are already recovered doesn't actually make a difference. The study was a randomized trial, unlike previous studies that did show some improvements. Since this study is more robust, it is more likely that this one is more accurate than the previous studies, which is unfortunate. We had some really big hopes for the blood plasma from recovered patients actually making a difference, but it doesn't seem to. Again, it's a single trial. It is a more robust trial, but it is just one, so we do need more research on that still. The excess deaths number was updated, and we're now at about 300,000. That means about 1/3 of the excess deaths were either not caused directly by COVID-19, or they just weren't counted correctly. Many people still believe conspiracy theories that claim the actual deaths from COVID-19 are super low, and doctors are just getting paid to put COVID-19 on the death certificates. That truth is so unlikely, though. The truth that is likely is that we're just undercounting. That's based on the number of excess deaths and the fact that we don't have any other outbreaks going on that would account for those excess deaths that are not accounted for by COVID-19. So most likely explanation here is that the majority of those excess deaths that are not part of the COVID-19 death count were actually COVID-19 deaths that just didn't get counted. So let's move away from the bad news now and on to news that may not be good necessarily, but at least it's not bad. It's more just kind of housekeeping things. The CDC has updated a couple of guidelines. First, they now strongly recommend mandatory masks for airplanes, trains, subways, taxis, buses, and other forms of transportation where people are packed in with others not of their household. This would even include like Uber and Lyft services. They also call for masks at transportation hubs like airports and train stations. Second, the definition of close contact has changed. Initially, the CDC said that close contact meant being less than 6 feet away from an infected person for 15 minutes or more. They now say, based on new studies, that the 15 minutes does not need to be all at once. If you spend at least 15 total minutes within 6 feet of an infected person over a 24-hour period, you have a much higher chance of contracting COVID-19. So whether it's 15 minutes all at once, or 1 minute here, 15 times here and there, 15 times throughout the day, or 10 minutes here, 2 minutes there, another 3 minutes somewhere else. If it adds up to 15 minutes within a 24-hour period, that puts you at higher risk. So let's talk about some good COVID-19 news now. A number of new studies have found genes that show a link to how well people fight COVID-19. Others show new understandings of how the virus infects our cells. And still other studies are of existing drugs that could be repurposed for use against COVID-19. There's still quite a bit of work to do with those studies, but that's a lot of potential. So much of the news in those studies is pretty technical, so I won't go into detail here, but I have included links to those studies down below the video, so feel free to check them out if you want to. New options may soon become available for face masks. Researchers have found a way to coat cloth masks with nanofibers that work just as well as N95 masks. This could decrease costs and allow better breathability without compromising on protection. Also, even though the death rate of COVID-19 is still higher than the flu and many other diseases, a couple of new peer-reviewed studies show that the death rate, especially among hospitalized patients, has fallen since the beginning of the pandemic. Early on, hospitalized patients had a 25% chance of dying. But by August, when the study ended, it was less than 10%. Researchers attribute the decrease in deaths to a number of factors, including a better understanding of the virus, newly available treatments, and more people following CDC Guidelines, which has helped to flatten the curve and avoid overwhelming hospitals. Unfortunately, since the study ended, many hospitals across the country have started to fill again, with some already reaching or exceeding their maximum capacity. One issue, especially in less populated areas, is that even with sufficient beds and equipment at the hospitals, the staff needed to take care of the additional patients isn't enough. COVID-19 patients, especially those that get to the point where they need an ICU or they need a ventilator or something like that, actually require more staff than a typical patient would. So we really need to keep working on flattening that curve. We also have a bit of non-COVID news this week. First off, a specific sugar molecule found in the tissues of mammals, but not birds or fish, has been shown in the past to increase the risk of cancer. A new study has shown that intake of that sugar through eating meat from mammals, so beef, pork, lamb, etc., and drinking milk or eating dairy products from cows, goats, or other mammals, does transfer that sugar to humans and also increases the risk of cancer. This kind of goes along with what we reported on before about eating red meat increases your chance of colorectal cancer. As we've mentioned before, a diet that is high in fruits, vegetables, and whole grains has been shown scientifically many times over to be the healthiest option. That doesn't mean you shouldn't consume meat or dairy at all, just use moderation. Researchers in Finland studied the effect of the environment on children's health. They took multiple daycare centers with similar environments and populations and changed the environments in some of them. They ended up with 3 types of daycare. The ones with typical concrete and gravel play areas, the outside play areas, the changed ones with grass and other plants in the play area, and the ones where children were taken to a separate nature area for playtime every day. They found that the immune systems of those who spent more time in nature, either by going to a separate nature area or by having their play area changed, actually had better immune systems and were much healthier than those that were still in the concrete and gravel areas. Even their gut microbiome changed substantially within even just 1 month. The takeaway here is that there is truth to the assumption that spending time with nature makes you healthier. A new study has shown that baby bottles can release millions of microplastic particles when used for preparing formula or other heated liquids. Previous studies have shown that other plastic containers can do the same. Research on whether this is actually dangerous is mixed. Some studies show that it is dangerous, others show that there is no danger. It's still debatable at this point whether it's really dangerous or not. Most people assume that there probably is some danger in it, just because of what we've seen with plastics throughout the environment, but we don't completely know for sure yet. Public health professionals have long recommended breastfeeding for infants as the safest and most nutritious option, but we realize that there are situations where that isn't possible, and so in those situations it's probably better to be a bit cautious and use glass bottles, or at least mix the formula in a glass container, then let it cool and then transfer it to the plastic bottle. Though shaking room temperature liquids in a plastic bottle will still release microplastics, the higher the temperature, the more particles will be released. So definitely try to avoid shaking hot liquid inside of plastic bottles or any other container. Thank you for watching the Plain English Public Health Weekly Report for October 23rd, 2020. As always, we have more links below the video for things that we weren't able to get to, and also with more information about things we did talk about. I'm Richard Greenland, and you have a healthy weekend.